Ladies and gentlemen, good evening. We are still discussing about kidney failure, and I've always insisted since I started this topic. Kidneys are one of the most important organs in our body, and when your kidney fails, it causes serious problems and complications in your body. And in this topic we'll be discussing about lifestyle modifications when having kidney failure. How will you modify your lifestyle or the way you live to make it easy for you to thrive with this kind of disease? Because we say when the kidneys are fully failed, they can be reversed. And before we continue, if you are there and you are watching this channel for the first time, just take a second or two, subscribe, and don't forget to put the notification on so that whenever I upload a video like this, YouTube will automatically notify you, and you will never miss any of our videos. For those who have subscribed, I always appreciate you, and for the returning subscribers, I always appreciate you because it's because of your support that this channel is where it is at the moment, and without your support, we can't be where we are at this moment in time. Lifestyle modifications when having kidney failure. How will you change your life? How will you modify your life to fit in your current predicament or your current situation? Minimizing your intake of alcohol for those who are druggards. Minimizing your intake of alcohol and making dietary changes may help prevent kidney failure from progressing. Remember, this is something that has started. So if you will minimize your alcohol intake and making dietary changes, or you change your diet, this might prevent kidney failure from progressing or getting worse. In the early stages and beyond, it's possible in the early stages and beyond, it's possible to manage and slow progression with lifestyle factors such as the following. In the early stages and beyond, this means early stages of kidney failure, or when you realize that your kidneys are failing, or when you see signs and symptoms of early kidney failure. If the early stages and in the early stages and beyond, it's possible to manage and slow progression with lifestyle factors such as number one, dietary changes, or changing your diet to fit your present predicament or your present situation. The guidelines for what you should eat will often depend on the stage of kidney disease you have and your overall health. This is very important. If in the early stages and beyond, it's possible to manage and slow progression with lifestyle factors such as the following. Number one, dietary changes. The guidelines for what you should eat will often depend on the stage of kidney disease you have and your overall health. So what you will eat will depend on the stage of your kidney disease or your kidney failure. So if somebody is in stage 1, the diet will differ from someone who is stage 4 or stage 5 of maybe chronic kidney failure. So the guidelines for what you eat will often depend on the stage of kidney disease you have and your overall health. Some recommendations might include the following. All the recommendations you can be given on the part of dietary changes when you are having kidney failure include the following. Number 1, limiting sodium and potassium. Limiting sodium and potassium. Aim to eat less than 2000 milligrams per day of both sodium, which is salt, and potassium. Limiting sodium and potassium. Aim to eat less than 2000 milligrams per day of both sodium, which is salt, and potassium. Number 2, limiting phosphorus. Limiting phosphorus. Try to stay below 1000 milligrams of phosphorus. This is very important. Try to stay below 1000 milligrams of phosphorus. Following protein guidelines. In early and moderate kidney disease, you might want to cut back on protein consumption. Following protein guidelines. In early and moderate kidney disease, you might want to cut back on protein consumption, but you may eat more protein in end-stage kidney failure depending on your doctor's recommendations. Very important. I hope you are together in this. Let nobody be left behind on this topic because it's very, very important and majority of you have requested this topic. So, following protein guidelines. In early and moderate kidney disease, you might want to cut back on protein consumption, but you may eat more protein in end-stage kidney failure depending on your doctor's recommendations. So the much proteins you are going to take will depend on your doctor's recommendation depending on the state and condition of your kidney. A point to note, which is very important. Beyond these general guidelines, the doctor may also ask you to avoid certain foods. For example, beyond these general guidelines, the doctor may also ask you to avoid certain foods. For example, which foods can a doctor advise you not to use, not to consume while you are having kidney failure depending on the stage? Because we have said in dietary changes it will depend on the stage of the kidney failure. So that's why we are saying beyond these general guidelines, your doctor may also ask to avoid certain foods. For example, lowering alcohol intake. If you are a drunkard, your doctor will keep on asking you or requesting you to lower alcohol intake. If you have kidney failure, and drink alcohol, your kidneys must work harder than they already do. Lowering alcohol intake. If you have kidney failure and drink alcohol, here is a scenario or a situation whereby you have kidney failure and you also take alcohol. How will you balance the two? Taking the alcohol, bearing in mind that your kidney have failed or your kidneys are failing. If you have kidney failure and drink alcohol, your kidneys must work harder than they already do. Alcohol does not metabolize out of your system. Very important. Alcohol does not metabolize out of your system. So if you have complete kidney failure, you will feel its effect until you receive dialysis to filter it from your blood. Alcohol does not metabolize out of your system. Alcohol does not metabolize out of your system. So if you have complete kidney failure, you will feel its effect until you have received dialysis to filter it from your blood. So here, or in this scenario, you have to get or receive dialysis to filter the alcohol from your blood. This marks the end of our video today. Thank you for your support. Thank you for being with me. And thank you for those who are still DMing me and requesting more topics, especially kidney stones. I've seen most of you saying that we discuss about kidney stones, and I assure you after this, the next topic will be about kidney stones. So let's continue sharing, liking our videos, and encourage our brothers and sisters to subscribe, like, and comment on our videos so that they may reach as many people as possible. Let's meet in our next video. Good day.